of the main reasons that we are all so passionate about it is that maternal mental health is still an underserved aspect for the United States. Over the course of a pregnancy, the woman receives medical care in the U.S. and they can expect to be stuck with needles, prodded with ultrasound wands, and have pee in countless cups, and just submit to any testing, measuring, poking that may give us any data on her body or the fetus. But when it comes to mental health, that medical care juggernaut just comes to a screeching halt. And in the US, many expectant mothers can get little more than a checklist of questions about their mood or a cursory discussion with their provider. And the result of that becomes that mental health problems often go unaddressed. Roughly 1 in 5 women in the US ends up developing postpartum depression after delivering a child. And an estimated 25% of those cases tend to emerge within the pregnancy itself. And it's not just in the postpartum area. And the leading cause of pregnancy-related death is mental health conditions. So 23% when you look at CDC data of mental health conditions, and this is leading cause of death. So this is either suicide, overdose, or poisoning-related death. The second leading cause of death, 14%, is excessive bleeding. So by far, when you look at the extent of the problem from a mortality perspective, it is a huge issue, and from a morbidity perspective as well. In Arizona, the problem is also grave. So almost half of all pregnancy-associated deaths in Arizona were related to mental health conditions. And when you look at the Arizona Department of Health Services data, 98% of pregnancy-associated deaths related to mental health conditions or substance use disorders were classified as preventable. I'm going to say that again, just so you guys can understand that gravity of what I just said. 98% of pregnancy-associated deaths related to mental health conditions or substance use disorders in the state of Arizona were classified as preventable. And this is why we're trying to talk more about maternal mental health.